Mr. Chair, thank you. Members, thank you. I'm presenting AB 2174, and I'm confident that the committee has a strong understanding of the bill. I do have one witness that has flown up from San Diego to present today. I'd like to give her the floor and then answer any questions as a result of that. And then she's going to politely ask to be dismissed after her presentation. She has a flight to catch to get back home. And so if we can give our attention to Ms. Moreland, I'd appreciate it. Thank you.
Great. Thank you. Please proceed.
Hello. My name is Joe Moreland. Imagine how you would feel if, without telling you, someone gave your identifying and cancer information, including your social security number and birth date, to strangers who paid for it. That's what the state's California Cancer Registry has done to me and many other cancer patients since 1988, releasing our information to researchers without telling us. When a UCSD cancer researcher wrote to me about her study in 2011, I thought it was a scam. No one had told me about the registry, even though my information was submitted to it twice after 2 surgeries within 9 months for unrelated cancers. I believe in ethical cancer research because we need it. However, in my opinion, the California Cancer Registry simply uses patients to keep getting money from cancer researchers. As my grandson told me, good government is supposed to protect its citizens, but California is operating a business that takes advantage of cancer patients. The UCSD researcher's letter shocked, disgusted, frightened, and angered me. I immediately hit the phone. I quickly discovered the state process is legal, that federal HIPAA law doesn't protect cancer patients' privacy, and that the California Cancer Registry wasn't interested in changing the system. If I had been told about the registry shortly after my first or even second diagnosis, my reaction to the UCSD researcher's letter would have been different. As an informed patient, knowing I truly had a choice about cancer research, I would have considered that researcher's study. Instead, for almost 5 years, I have struggled to get real privacy rights for all of California's cancer patients because almost all of them are reported to the registry. A U.S. Centers for Disease Control study found that more than 30 other state registries protect cancer patients' privacy better than California. And usually it's done more affordably and without adversely affecting cancer research. They require researchers to make contact through the patient's doctors. Some charge researchers for notifying patients. Our California Cancer Registry officials and researchers have repeatedly told me our registry law has to be amended before our cancer patients get the real research information they need. Assembly Bill 2174 is your opportunity to make that happen. Please help us. Thank you.
Thank you very much. Other witnesses in support? Okay, seeing none. Any witnesses in opposition? Please come forward.
Chair and members, Autumn Ogden on behalf of the American Cancer Society Cancer Action Network, and regretfully we are here to oppose the bill today. While the intent of the bill is laudable to ensure that patients are notified about what happens with information related to their cancer diagnosis and the right to ask not to be contacted by any cancer research studies, it is not necessary. We understand that it attempts to streamline the process of notification and responds to patients' concerns about being contacted by a cancer researcher, but California already requires that patients be notified that their information is being reported to the registry, and they do have an opportunity to opt out of registry research. Current state regulations require the reporting physician to inform patients that their cancer diagnosis has been reported to the registry as required by law. While the bill requires the Department of Public Health to ensure that the patients have been contacted and informed of their rights, it does not specify how the information about the notification is to be obtained or what to do should they discover the patient has not been notified. Furthermore, this bill would potentially put the Department of Public Health in a position to follow up with the patient, taking it out of the physician's hands, who could provide greater opportunity for communication in a culturally appropriate manner that accounts for language barriers. And so for these reasons, we respectfully request a no vote.
Great. Thank you very much. Anyone else in opposition? Questions or comments from anyone on the dais? Any questions? First of all, we're one shy of a quorum. We're getting closer, so we can't take action on your bill at this point. First of all, and I want to thank you, Mr. Jones, for bringing this forward. I will tell you that when we first looked at the bill, I was inclined to want to agree with the opposition. However, in a small circle of friends that I have, I actually come across a couple people who didn't get the information. And that's critical in the process. They didn't get the opportunity to opt out because they didn't know. So clearly we have something missing in the process. And so my recommendation because of that is going to be to support your bill today. And when we get one more person here, we're going to put a whole bunch of bills up for a vote.
Well, thank you, Mr. Chairman.
Feel free to close.
I'll give a short close, and maybe in that time frame, somebody hiding out in the hallway will come in and sign in so we can get the first vote off today. But thank you for doing that poll with your close friends. I took a poll myself of myself because I was diagnosed and treated for cancer in 1999. I had thyroid cancer and undergone 2 surgeries and had a diagnosis and a prognosis that was positive as a result of that. And when Ms. Moreland contacted my office regarding this, I said, there's no way that this is accurate, this constituent complaint. I mean, this can't be. And so I had my staff anonymously call the cancer registry and start, pursuing this. And sure enough, the cancer registry had my personal information, my diagnosis, my prognosis, my Social Security number, my personal health record, and I had no idea that had happened. And so I did an additional poll, Dr. Wood. I started talking to some of the doctors that I know personally, asking them if they knew that it was a requirement of them to pass along this information to their patients. I did not have one physician tell me that they knew that this was a requirement for them to pass this along. So I agree with you, and thank you, sir, that there is a deficiency in the system. I've been working on this since 2014. The bill that I worked on in 2014 was a little bit more prescriptive than what this bill is, but we do need to move forward, and I do continue and plan to work with Department of Health to come to a conclusion, and then hopefully have legislation that supports that. So thank you for your support.
Great. Thank you very much. So we will be moving on. Mr. Lowe, are you ready out there? Come on up. Oh. Stop. It's a miracle. Madam Secretary, please take the roll before it vaporizes.
Wood.
Here.
Mainshine. Here. Bonilla. Burke. Campos. Chu. Tababne. Gomez. Hernandez. Lackey. Nazarian. Olson. Patterson. Ridley Thomas. Rodriguez. Santiago. Steinnorth. Thurman. Waldron.
Okay, so I apologize. We have a quorum. Actually, wow, it's growing by leaps and bounds. We have more than a quorum now. Go ahead. Let's see. Let's go ahead. We'll go ahead and present your bill. We'll come back and deal with some votes in a minute. So please go ahead, Mr. Lowe.
Thank you very much, Mr. Chair. This is Assembly Bill 1831, which will provide refill coverage for covered topical products after 70% of expected days of use. And this is one of those areas in which both the the optometrists and the ophthalmologists have come together in agreement, and so it's a great opportunity, and I respectfully ask for aye vote. I have with me here Kara Coaches with the California Optometric Association and Jody Hicks representing the California Academy of Eye Physicians and Surgeons. And we'll start with Kara.
Good afternoon, Mr. Chairman and members of the committee. My name is Kara Corches. I am here today on behalf of the California Optometric Association in support of AB 1831. This bill allows for early refills of topical ophthalmic products such as eye drops or ointments, which are used to treat a variety of acute and chronic eye conditions such as glaucoma. Whether it is a shaky hand or simply just flinching before the drop hits your eye, this is unavoidable waste of drops, and patients often run out of their prescription too early. Furthermore, glaucoma patients are often elderly and have difficulty dispensing the appropriate amount of eye drops. The Centers of Medicare and Medicaid Services issued guidance in 2010 recommending early refills. Furthermore, other states have also enacted similar legislation to AB 1831, recognizing the necessity of early refills for eye drops. Therefore, I respectfully request your aye vote. Thank you.
Further witnesses in support?
Jody Hicks, thank you. Representing the California Academy of Eye Physicians and Surgeons, really pleased to be here as a co-sponsor and to sit alongside our colleagues, the optometrists. And we just see this as a huge measure for patients. Anybody that's used eye drops, whether it's children or elderly or anyone, honestly, myself, that's tried to use them knows that there's always a time that you're using extra drops or it falls to the side, and it's nearly impossible to not waste some of that medicine. So this is an important bill to allow for refills, and we ask for your support. Thank you.
Thank you. Other witnesses in support, name and organization only, please.
Tam Mott with Health Access and Support.
Greg Herner on behalf of the California Life Sciences Association in support.
Megan Maddox with the California Pharmacists Association in support.
Mike Montgomery with the Congress of California Seniors in support.
I figured that's where the cutoff was. Mr. Luizas, please come forward.
Thank you, Mr. Chair and members. Nick Luizos on behalf of the California Association of Health Plans. We are regrettably in opposition to AB 1831. We've already had the discussion about the cumulative impact of benefit mandates and the impact that these bills have on premiums for individuals and employers. Some bills, such as this one, only impact premiums marginally, others more substantially. But regrettably, we do oppose AB 1831 at this time. From a specific basis, we oppose the bill because it conflicts with some of the policies that our health plans employ. Some of our plans do have refill policies that are consistent with this bill. Others do not. We have engaged in an initial discussion with the author's office about potential changes to the bill that would allow plans more flexibility in this area. Other states, as the support witnesses have acknowledged, have implemented legislation in this area in a manner that removed health plan opposition. So we have supplied some of those examples to the author's office for consideration as well. I think if we can adjust the percentage or do this on a number of days basis, which is much easier to track, this may be more palatable to our members. So we'd like the author to consider that as well. We would say that, however, the bill in its condition at this time is something that we have to oppose. Thank you very much.
Thank you. Others in opposition?
Yeah, John Winger on behalf of America's Health Insurance Plans. We would echo the comments of CAP, also opposed.
Great, thank you.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies, also opposed.
Great, thank you. Bringing it back to anybody in between? It's either black or white. Okay, all right. Bring it back to the committee. Any comments or questions from the committee? Okay, seeing none, appreciate you bringing the bill forward. Also, I want to reiterate, and the Vice Chair and I agree on this. We've talked about this. We are concerned in the long run about a compilation of the cumulative impact of mandates, and so that's something that he and I and hopefully others will begin to look at. But in this particular case and in some of the others today, I'm actually recommending an aye vote. So thank you for bringing this forward, Madam Secretary. Please call the first roll of the day.
Wood.
Aye.
Wood, aye. Mainshine. Bonilla. Bonilla, I. Burke. Burke, I. Campos. Chu. Topavne. Gomez. Hernandez. Lackey. Lackey, I. Nazarian. Olson. Olson, I. Patterson. Patterson not voting. Ridley Thomas. Rodriguez. Rodriguez, I. Santiago. Stein North. Stein North, I. Thurman. Thurman, I. Waldron. Waldron, I.
You have 9 votes and none against, 1 not voting, so you need 1 more. But you're way ahead of everyone else on this up here. So just for the audience and especially other authors out there, I'm going to take Mr. Dolly next, and then I'm going to take a couple of authors from the dais after that. So Ms. Burke, followed by Ms. Bonilla. So Mr. Dolly, please come forward. And just so anybody's watching out there, you got a little extra time, but Ms. Burke and Ms. Bonilla will be going next after this. So, pardon? Well, they're not here. So, Mr. Dolly.
2313 would authorize California district and municipal public hospitals to participate in a demonstration project to reduce the administrative costs and burdens associated with the outdated cost report done by these hospitals. I thought I had some witnesses here, but apparently, since you're moving quickly, I don't.
Relative, Mr. Dolly.
But I would. This is going to be basically a study to hopefully reduce the burden of reporting to 2 into 1, and so I respectfully ask for an aye vote.
Kat, please.
I got a motion and a second. And
Bravo.
Catherine Austin Scott, representing the District Hospital Leadership Forum. I'm going to take a deep breath. And thank you. This bill will allow us to combine reports that we currently provide to both OSHPD and the department. It will allow us to hopefully contain and eliminate some of that information so that we can make that process more efficient for these hospitals. Thank you.
Breathe. Please breathe. It's okay.
Kelly Brooks on behalf of the Association of California Healthcare Districts. 39 of our districts are participating in the waiver, and we are in support of the demonstration project.
Great. Thank you. Anybody in opposition? I'm making sure that in case they need to run down the aisle like you did, too.
He snuck in.
He did. So any questions or comments from anyone? I do have a question for you, and that's just concerns about DHCS points out that costs are federally required to capture allowable Medicaid costs as such. So the elimination may require federal change. Do you have any thoughts on that at this point?
We plan to, in the process, work with the department to determine what is required by the feds and what is being done and provided to OSHPD. So if there is information that's required by the feds, we'll continue to submit that as necessary, but may be able to eliminate or create a single report that also complies with OSHPD's data requirements. And if there's information that, frankly, the department determines it doesn't need for some of those cost reports, we can work with the feds through a state plan amendment as well. But we're just hopeful to get those 2 reports into one single format.
Great. Well, thank you. Mr. Dolly, thanks for bringing this forward. It's anything we could do to streamline the process without creating other problems. I'm very, very supportive of. So I appreciate you bringing forward the bill. It enjoys an aye recommendation to appropriations. We actually do have a motion and a second. The motion is due pass to appropriations, and I'll ask the secretary to call the roll.
Wood?
Aye.
Wood, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Bonilla, aye. Burke? Aye. Burke, aye. Campos? Campos, aye. Chu? Tababne? Gomez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian?
Mr. Nazarian, thank you.
Nazarian, aye. Olson? Olson, aye. Patterson? Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Steinnorth? Steinnorth, aye. Thurman? Thurman, aye. Waldron? Waldron, aye.
Congratulations, Mr. Dolly. You're the first bill to get out of here today, 12-0.
Thank you.
All right. Thank you very much. Ms. Burke.
Thank you. Mr. Chair and members, first, I am happy to accept the technical amendments outlined in the mock-up drafted by staff. For many women, reproductive health care is primary care. Nearly 3/4 of women of reproductive age in the nation receive at least one sexual or reproductive health service each year. Changes in the law at both the federal and state level have increased timely access to birth control and preventative care for patients covered by commercial plans and Medi-Cal. However, even though commercial plans are required to ensure access to care and services within their networks, they vary widely in terms of network adequacy and referral policies. While some plans allow direct access to a reproductive health care provider, others require patients to first get a referral from their primary care physician. The variation in policies has created a patchwork of coverage and access to care. AB 1954 builds on current state and federal laws by prohibiting referral requirements for in-network reproductive health care by removing the unnecessary administrative barriers that cause delays in care and leveling the playing field across health plans. California will have more equitable access to time-sensitive, reproductive, and sexual health care services. I respectfully request and I vote.
I'd like to move the bill.
Second. Okay.
Thank you.
Yeah, witnesses, please go ahead. Thank you.
Good afternoon. Good afternoon, Mr. Chairman and members of the committee. My name is Sylvia Castillo, and I'm here representing California Family Health Council. CFHC champions and promotes quality and sexual reproductive health care for all Californians. We administer the federal Title X family planning program in the state of California that supports the delivery of quality family planning services to nearly 1 million men, women, and teens each year at over 340 health centers statewide. CFHC is proud to co-sponsor this legislation along with our partners, and we thank Assemblymember Burke for her leadership on this important measure for women's health. AB 1954 is a straightforward, common sense legislation that seeks to eliminate unnecessary administrative burdens that create barriers to timely access to sexual and reproductive health care. The bill has been amended to focus on one simple yet impactful policy innovation: allow enrollees in commercial health insurance plans to obtain direct access to reproductive and sexual health services. Health plans currently vary widely in the referral policies. Some plans already allow direct access to these services. Other plans allow direct access to an OBGYN. And a few allow this only if the OBGYN is also designated as the enrollee's primary care provider, as allowed under California law for over a decade. Others still require referrals for all non-urgent or emergency services. AB 1954 was developed to level the playing field and ensure direct and equal access for all, not just some Californians seeking these sensitive services, which include family planning, STD testing and treatment, and abortion care. Extensive studies show that for the overwhelming majority of women in the U.S., reproductive and sexual health care providers are their main, if not only, source of health care in the year. And access to these services is often a woman's gateway into the health system. Recognizing the importance of direct access as a preventative measure for women's health, Congress included a provision allowing direct access to an OBGYN without a referral in the Affordable Care Act. AB 1954 will codify this advancement in women's health into California law and build on it. The measure recognizes that direct access should be about time-sensitive services received, not the provider type. California women access these services from OBGYNs, as well as advanced practice clinicians like nurse practitioners, physician's assistants, and certified nurse midwives. The bill continues California's long history of leadership and commitment to breaking down barriers to reproductive health access and saving public dollars along the way. For these reasons, we strongly urge your support.
Thank you. Please go ahead.
My name is Rebecca Griffin. I'm the Assistant Director of California Programs for NARAL Pro-Choice California, and we work to mobilize the pro-choice majority in our state to protect and expand reproductive freedom. We are very happy to be here co-sponsoring this bill with CFHC and our other partners, and thank Assemblymember Burke for her continued leadership on protecting women's health. Requiring enrollees to get a referral or authorization prior to accessing reproductive health services is an unnecessary administrative hurdle. When it comes to these kinds of time-sensitive services, every day counts. This is particularly true when it comes to abortion care. And imagine if you are making a decision that's a very personal and private decision and that given your circumstances, maybe you aren't even sharing with your close friends and family, and you have to call up a primary care provider to get that referral. Maybe that discomfort causes you to delay in making that call, your life is busy, and next thing you know, you've waited days, weeks, and then once you finally make that call, that person has to go through their whole process to get you approved. If you don't have a primary care provider, that whole process becomes even more burdensome. In the most extreme cases, this kind of policy opens the door for individual providers' religious beliefs to get in the way of women's access. One of our partners, Women's Health Specialist, which has clinics around Northern California, had a patient in Roseville who couldn't get birth control at their clinic, even though it was in network, without a referral. And her primary care provider refused that referral and cited her individual religious beliefs as the reason for that. This kind of action and these unnecessary delays have no place in California. AB 1954 is a simple solution to this problem, and California can continue to lead by breaking down barriers to these services. For these reasons, we urge you to vote yes. Thank you.
Thank you very much. Other witnesses in support? Just your name and organization, please.
Geraldine Stapleton, President of the California National Organization for Women, in very strong support of this bill.
Thank you.
Request an aye vote.
Thank you.
Dennis Cuevas Romero, here on behalf of the California Latinas for Reproductive Justice, proud co-sponsors of the bill.
Thank you.
Shireen Dada Whitaker with Women's Health Specialists, in strong support.
Thank you.
Jody Hicks with the California Academy of Family Physicians, in support.
Thank you.
Zori Whitaker, volunteer escort for Women's Health Specialists, in support.
Thank you.
Rebecca Gonzalez, National Association of Social Workers, California chapter, in support.
Thank you.
Chris Rosa on behalf of BEAR, in support.
Thank you. Anyone else in support? Okay. Opposition, please come forward.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. First, we'd like to thank the author and sponsor of the bill. We have been working closely with them to come to sort of an agreement regarding the services and referral requirements. I think we were really close. Right now, we are still in opposition, but I know that there are some final issues that we're trying to work out regarding narrowing the referral requirements. But we look forward to continuing to work with them and hope to come to a resolution. Thank you.
Thank you.
And Jennifer Alley with California Association of Health Plans. We too have been working with the author, her staff, and the sponsors, and are very close to resolving all of our issues with the bill. Thank you.
Great. Thank you. Thank you very much. Appreciate it. Others in opposition, just your name and organization, please.
Yeah, John Winger on behalf of America's Health Insurance Plans. We'd echo the comments of Cap and Acklick.
Super. Thank you.
Ralph Merletti, South Sacramento, St. Rose Catholic Parish, and I strongly oppose this bill.
Okay, thank you.
John Girardi, California Family Alliance. We strongly oppose this bill.
Thank you. Bringing it back to the committee for questions and comments. Seeing no one, we have a motion. We have a motion and a second. We'll have this, Madam Secretary, call the roll, please. I'm sorry, you did accept our amendments, so the motion is do pass as amended to appropriations.
Wood?
Aye.
Wood, aye. Mainshine?
Aye.
Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Campos? Campos, aye. Chu? Tababne? Tababne, aye. Gomez? Hernandez? Lackey? No. Lackey, no. Nazarian? Olson? Patterson? Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Steinnorth? Steinnorth, no. Thurmond? Thurmond, aye. Waldron? Waldron, no.